So good day everyone, we are the second group and now we're going to be discussing about oral thrush, the process and causes of the disease and its outcomes to our oral cavity.
Okay, so oral thrush is caused by the overgrowth of a type of fungus called Candida. It is also known as oral candidiasis, oropharyngeal candidiasis, or simply thrush. It is a condition in which the fungus Candida albicans accumulates on the lining of your mouth. Candida is a normal organism in your mouth, but sometimes it can cause symptoms. Oral thrush cause creamy white lesion, usually on the tongue, roof of the tongue or in the inner cheeks. Those spots usually goes away with treatments. The infections are typically mild and rare causes serious problems, and it is often treated easily. But in some cases, with people with a weak immune system, it can spread through other parts of the body and cause potential serious complications.
So Candida is typically seen living normally on the skin as well as inside the body. And typical examples of this would be in the vagina, mouth, or the throat without causing any complications or diseases. Basically, Candida is actually just already in our bodies. As I have said, it is typically seen in areas of the body such as the mouth, throat, vagina, and even other parts of the body. But it causes infection um, when Candida multiplies or overgrows, thus it causes infection. So when an infection caused by the said fungus happens in the mouth or throat, it is then considered an oral thrush. So as said by Carl earlier, Candida will only overgrow or multiply in environments where it is encouraged to do so. An example of this environment would be in a diabetic patient. So per se, so a diabetic person would have high amounts of sugar in their body, and these high amounts of sugar would encourage the candida to actually grow and over multiply, thus causing infection. Um, the most another example is the most common environment, and this is when the person has prolonged exposure, prolonged ingestion, or overusing of antibiotics. It is important to take note that oral thrush is contracted by people with HIV or AIDS. That is because people with HIV or AIDS actually have weakened immune system. So when this happens, um, typically the body's defenses or the immune system actually keep candida from multiplying and growing out of control. But when these body's defenses become weakened by HIV/AIDS, they become overwhelmed, and thus the candida would go out of control and causing an infection. That makes it easier for candida to infect different parts of the body, and in this case, the mouth or throat, causing an oral thrush. Hence, that is why people with HIV or AIDS are prone to getting oral thrush.
Pathophysiology of oral thrush. It is an opportunistic organism that caused by Candida species or fungi. It is passed on by direct touch when normal host immunity or normal host flora are damaged. Yes, overgrowth occurs, providing a chance for Candida species to multiply. When yeast overgrows on the oral mucosa, the epithelial layer peels off in scales or flakes. It enters the tissues and infiltrates the circulation system, triggering the coagulation cascade. Bacteria, keratin, and necrotic tissue will join to form a pseudomembrane. It also causes white palago build up in the oral mucosa and turns into oral thrush. It is very usual for newborn to colonize when they pass through the vaginal canal. The contaminated items that we'll use on the babies are another risk of transmission. It can be harmed by inhaled corticor- corticosteroids that used to treat asthma. The infections occurs because the steroids in the inhaler weaken the immune system in the mouth and throat. Patients who are immune compromised may develop candida esophagitis. It is caused by Candida albicans 88% of time, herpes simplex virus 10% of the time, and cytomegalovirus 2% of the time. Patient with esophageal candidiasis may exhibit a variety of symptoms or be symptomatic. In a healthy patients, the patient's immune system and normal bacteria flora inhibit Candida growth. Consequently, immunosuppression such as diabetes, denture, steroid use, malnutrition, vitamins deficiency, and recent antibiotic use often leads to the disease.
Now, I am going to talk about the clinical manifestations of oral thrush. Oral thrush, it usually develops suddenly. In its early stages, it may not cause any symptoms, but as the infection gets worse, one or more of the following symptoms may develop. As can be seen in figures 3.1 and 3.2, there are white creamy lesions present primarily in the tongue and tonsils that are somehow slightly elevated. In other cases, these white lesions can also be seen on the roof of the mouth and the back of your throat. Other symptoms may include redness and soreness inside and at the corners of your mouth, in which may result to the loss of ability to taste. This symptom can be depicted on figure 3.3. Again, other patients diagnosed with oral thrush may have redness outside the corners of the mouth that would also result to further becoming cracked and swollen, as can be seen in figure 3.6. In figure 3.5, the photo shows redness and slightly bleeding of the tongue. This is because the lesions can hurt and may bleed a little when you scrape them or brush your teeth, since the fungi already accumulated and adhered to the surface of the mouth. In severe cases, the lesions can spread into your esophagus and cause pain or difficulty in swallowing. A feeling that food gets stuck in the throat or mid-chest area are also felt. And in worst case, fever, if the infection spreads beyond the esophagus. In persons wearing dentures, most commonly in elders, a common condition may usually occur that is characterized by inflamed, puffy red tissue that follows the outline of a denture or other dental appliance that rests against the oral mucosa. This condition is termed as denture stomatitis, as can be seen in figure 3.4, wherein the candida, the fungus that causes oral thrush, goes out of control, resulting to fungal infection. There are times that the swollen tissue is accompanied by pinpoints of bleeding. Fortunately, denture stomatitis is not life-threatening or a condition that can be passed on to others.
So the signs and symptoms in adults and babies. So in adults, the mouth is red and white patches are observed. So when these white spots are wiped off, it leaves a red spots that can bleed. And some of the signs and symptoms can also be seen in babies. Other symptoms in adults are cracks at the corners of the mouth and not tasting things properly. There's also unpleasant taste as well as pain inside the mouth like a sore tongue or a sore gums. There's also difficulty in eating and drinking. Lastly, oral thrush in adults is not contagious. In babies, Some of the signs and symptoms that can be observed are white coating, and this cannot be rubbed off easily, so it is on the tongue like cottage cheese. There are times that there's white spots in the mouth of the babies, and once wiped off, it leaves red spots that may bleed just like in adults. Some of the symptoms in babies is that they do not want to feed, as well as a nappy rash. Babies can also pass oral thrush through breastfeeding. This can cause nipple thrush in mothers. Some of the signs and symptoms in females or mothers with infected breasts are very sensitive, itchy, cracked, or red nipples. Also, skin that is shiny or flaky on the nipples, darker, circular region around the nipples. There's also unusual discomfort while nursing or uncomfortable nipples in between feeding. Lastly, there's stabbing pains within the breast.
Now let us move on to the structure of the organism. Candida albicans is part of our natural microflora, the microorganisms that typically live in or on our bodies and can be found in the mouth, the vagina, and the GI tract. So the Candida albicans is always present but is asymptomatic until something alters or imbalances happen and causes it to overgrow. The morphologic structures of the Candida albicans, with a small and oval shape which measures 2 to 4 micrometers in diameter. It is a yeast-type fungus that grows as single cells, producing daughter cells either through budding or binary fission. And approximately 80 to 90% of its cell wall contains carbohydrate and 10% of it contains protein.
In conclusion, depending on the change in regulatory gene expression, the phenotype changes. It can be wide, round cells or opaque rod shape. Candida albicans reproduce through budding and asexual reproduction where a bud grows from the patient parent's body and separates to become another independent organism. The Candida albicans has three morphological states, and these are blastophores, pseudophore, and chlamydospore. Blastophores reproduced by budding and is responsible for reproduction of fungus spore. Pseudophore is in control of the budding patterns, cell adhesion, and cell elongation of the fungus. It also manifests different characteristics from the budding and true hyphal form of the Candida albicans. Lastly, chlamydospore is for pinpointing of the Candida albicans. It is integral for a filamentation process that could support sexual sporulation, and it also ensures survival of the fungus in harsh environmental conditions.
Alright, for histologic examination, basaloid or basaloid tumors and differentiated cuts present little to no keratinization. Warty or warty subtype of HPV appears of individually keratinized cells, hollow cell-like changes such as perinuclear enlargement. Sections of the skin with candidiasis exhibit mostly spongiotic alterations in the epidermis along with acanthosis that is irregular, mild spongiosis, and inflammatory changes.
So, basiloid tumors are undifferentiated cuts that present little to no keratinization, right? So, keratinization, as we all know, are cytoplasmic events which occur in the cytoplasm of the epidermal keratinocytes during their terminal differentiation. So, mag-involve sila og ng deformation of keratin polypeptides and their and polymerizing into keratin intermediate filaments or tonofilaments. While here in the warty or warty subtype of HPV or human papillomavirus, they appeared as keratinized cells, kanang butik-butik, mga butlig-butlig in the body through perinuclear enlargement. So here in the sections of the skin, there is also spongiotic alterations along the epidermis and acanthosis, which is irregular. So spongiotic, it means that there there is dermatitis that it involves fluid build up upon the skin. So murag magbutlig-butlig siya gamay, or in severe cases, it can populate into much more than just in a certain area of the skin. Now for acanthosis is a skin condition caused by acanthosis nigricans that causes discoloration in the body folds and creases. So uh, through this, our bodies can develop darkness, can mag discoloration. In light-skinned people, it can be purplish in a way, it can contribute to a purple color. And then in dark-skinned, it can be a little bit brownish or like darkish in color, in color way. It usually affects the armpits, in the areas of the groin and the neck, and yeah, it is a condition really that causes darkness of a certain area in the skin or thick velvety skin in the body, which contributes to folds and creases, much more like kind of mga atong wrinkles, but not necessarily wrinkles. Uh, yes, it really affects mostly in the armpit and the neck area.
Neutrophils in the stratum corneum and also in the upper layers of the epidermis are determining features of the superficial epidermis. The spongiform postulation suggests that the neutrophils may form tiny collections that resemble impetigo and psoriasis.
So here we can see that the neutrophils, they are present in the upper layers of the epidermis, which are the factors that can really determine the superficial epidermis. While in the spongiform postulation, there we can say na it really symbolizes, no, exhibits types of impetigo or psoriasis, a type of skin condition which shows red patches in the skin or other like kanang butlig-butlig gali. So yes, it really exhibits that kind of formation in the skin. So now we look at the comparison between normal or the controlled tongue with three samples and the tongue with oral thrush. So the panels show H and E staining, which is hematoxylin and eosin staining used in medical laboratories of the two tissue specimens from each experimental group, confirming one one presence of oral candidiasis or oral thrush, then the other one is the normal one, which can be seen at approximately 100 micrometer at 100 micrometer scale. Now, the samples show mucosal sections with the parakeratinized surface epithelium at the top here in both the control and the tongue with the oral thrush with their respective connective tissues. Ang ilang features in this group, they include the shaggy surface of the parakeratinized or the parakeratin na which also supports the neutrophilic aggregates that are intermixed within the spores and the pseudohyphae of the Candida albicans that cause the fungus that causes oral thrush. The basal cell layer is also intact and exhibited as basilar hyperplasia in some of the cases here. The fungal organisms can be identified using the PAS stain or the acid shift stain, and the image for one case is shown here in the undercandidiasis. Uh, the subepithelial connective tissue is supported in an intense, diffuse, and it is mixed with infiltrates of the presence of lymphocytes. There's also plasma cells, histiocytes, and occasionally neutrophils here in our samples, between the samples.
So there are a number of things you can do to reduce your chances of developing oral thrush. First is avoid sharing cups and utensils with others. Eat a nutritious diet and practice an overall healthy lifestyle to support the functioning of your immune system. Practice good oral hygiene by brushing your teeth twice a day and flossing every day. In addition to a good oral hygiene, it's important to drink enough fluids. You should also visit your dentist on a regular basis for checkups. If you smoke, you should stop smoking. If your mouth is chronically dry, make an appointment with your doctor and follow the recommended treatment plan. If you have dentures, you should remove your dentures every night, cleaning them with paste or soap and water before soaking them in a solution of water and denture cleaning tablet. If you have a corticosteroid inhaler, rinse out your mouth with water and or brush your teeth after using it. If if you should also ensure that any underlying condition you have, such as diabetes, is well controlled. Some people use probiotics like fluconazole, clotrimazole, intraconazole, and amphotericin B, which are antifungal medication, to prevent oral thrush that is prescribed by their doctors. These products are believed to restore a healthy balance of germs in the mouth so that the fungi and other harmful germs don't grow too much. In some studies, probiotics were shown to help prevent oral thrush in older people. So this ends up our discussion regarding oral thrush. We hope you learned something from us and have a great day. Thank you.